Hi guys, I hope you're doing well. My name is Dr. Ina Lakshan here at the Hormone Rebalance Center, and today I wanted to share with you some information about a very common condition that I see in practice, and that is estrogen dominance. So let's talk a little bit about what it is, how does it present, and then what are the causes and hence the solutions that you can implement in order to tackle this. So estrogen dominance is not actually any disease state in and of itself. It really speaks to an imbalance between estrogen relative to progesterone. So some symptoms that you can experience if you actually have estrogen dominance is pretty bad PMS, so any issues with your cycles, irregular periods or really heavy periods, painful periods, headaches with your periods, things like bloating, water retention, breast tenderness. So all these are classic symptoms of estrogen dominance. However, sometimes we worry too much of it just being an estrogen issue, and in reality, estrogen dominance can be because of one of three different scenarios. So number one, actually, truly having elevated estrogen relative to normal progesterone levels. Scenario number two is having normal estrogen levels, but relative to that having really low progesterone. So the body recognizes this gap of normal estrogen but low progesterone as an estrogen dominant state. Or the third scenario would actually be a combination of the two, both truly having elevated estrogen in the face of also lower progesterone. And the way you would know this is if you check, because here at the Hormone Rebalance we do quite extensive sophisticated hormone testing where we're able to see exactly which one of these scenarios is causing your symptoms, and so we know exactly what needs to be addressed. So assuming you know that you actually have estrogen dominance, what can you do about that? So you want to be looking at a couple of different factors and looking at what could be causing it to begin with, and because of that, due to that, you know how to address it. So for example, some reasons for having elevated estrogen is lower progesterone, or at least presenting with those symptoms. So like I mentioned, lower progesterone. You would end up with low progesterone as in the previous blog post that I talked about, because you may have an ovulatory cycle. So if you don't ovulate with your periods, you don't produce enough progesterone, but you continue to produce estrogen and you end up having a gap. So a solution to that would be to either regulate better your periods if they are the cause of low progesterone, or if you're not ovulating due to age, then you may want to consider supplementing with a progesterone cream if progesterone is actually low. The other factors you want to consider is exposure to environmental, what's called xenoestrogens, which is endocrine mimickers. They mimic our own estrogen levels and they act on our estrogen receptors. So these are things that you can find in certain soaps, creams, shampoos, any type of healthcare products, makeup, plastics, plastic water bottles. So you really want to be keeping your environment really clean of xenoestrogens, phthalate free. Really be mindful of getting good quality products if you apply them on your skin, because your skin really absorbs those things all too well. Other factors you want to be paying attention to is percent body fat. So our fat actually stores excess estrogen and generally stores hormones. So if you have too much of it, you may be storing too much estrogen, and that could be the reason why you may be struggling with estrogen dominance. So of course, losing some weight and specifically percent body fat can be of great help with that. And lastly, the fourth factor I always consider with patients is paying close attention to your processes of elimination. What that means is both the liver and the gut, you really want to be supporting those. The liver helps break down our hormones and the gut helps to excrete them. So you want to make sure that both these systems are really working optimally. You're eating lots of fiber, you're going to the bathroom regularly, you're doing regular cleanses, or really just supporting your liver and not burdening it with other toxins and such. One of my favorite supplements to use is called DIM. It comes from cruciferous vegetable family, so all the cauliflower, cabbages, broccoli, so all that family. It produces this ingredient called DIM, but you need to really eat a lot of it if you're trying to get a therapeutic dose. So while it's great to include those foods in your diet ongoingly for generally better estrogen metabolism, overall if you're trying to get therapeutic dose, you may may want to consider supplementing with this, okay? So I hope this helped you learn a little bit about this imbalance that I see very commonly with women. But again, you want to make sure that you're properly testing for this, because sometimes the solution is actually not doing anything with estrogen levels, but really supporting progesterone as an example to really offset and close that gap between two hormones that are out of balance, okay? If you have any more questions, please feel free to email me or send us some more information at info@hormonerebalance.com, or send me a private message on Facebook, and I'll be happy to get back to you, especially if there's any specific topics you'd like me to share with you, okay? I hope you enjoyed this. I hope you have a great evening. Bye for now.